Hello and welcome to today's webinar, our legislative update for the middle of the Indiana General Assembly session for 2014. This is Lucinda Nord with Indiana Association of United Ways, and I welcome you to this joint webinar that is conducted in partnership with three organizations: Indiana Association of United Ways, Indiana Nonprofit Resource Network, and Indiana Coalition for Human Services. And I am joined today by Mark St. John, who is my co-chair of the Indiana Coalition for Human Services Public Policy Committee. So, Mark, would you like to explain your role with ICHS?
I'm a past board member and a past president of the organization, and for several years I have co-chaired the Public Policy Committee. And then I represent the Indiana Association for Community Economic Development with the coalition.
Great. And for those of you who joined our previous session where we introduced the 2014 session, you might recall David Sklar did that webinar for us. So we will begin with giving you just a quick introduction. And I don't know if, Mark, you want to do the first few slides?
Sure. So I'll be real quick about this because this is kind of a repeat from the earlier session. This is a short session, and we are down to the final 3 weeks here. Move on. As you know, that there have been several hot issues, including the marriage amendment, which has changed significantly, tax issues, a discussion about health care, and a lot of discussion about education. Next slide. This is kind of a quick list of the governor's priorities. I would suggest that the big ones still are the phase out of the business personal property tax, the pre-K scholarships for low-income children, and this discussion about career and technical education work. Next slide. Just a quick reminder about what have been the priorities for the Coalition for Human Services. It included implementation of the Affordable Care Act, drug testing on TANF, some issues around unemployment insurance and work sharing, a lot of attention to early education and pre-K, and about accountability and income outcomes, rather.
Great. So thanks, Mark, for that introduction. I'll go ahead and talk a little bit. What we're going to do is actually walk through some status updates of where specific bills are, and as if you are looking at the screen, anything that is sort of grayed out in a lighter color is a bill that was introduced. We may have talked about it in our prior session, that is now actually no longer alive as a bill. And just as a matter of process, bills have to, language has to pass one chamber, the first chamber, in order to still be alive in some fashion throughout the rest of the year, or it has to at least have been heard. So there were a number of bills related to Healthy Hoosiers, and a number of them did not get a hearing, which means they are dead because we're in the second half of the session. The bills that are still alive, as you can see, are listed here. Probably the big concern for the Coalition for Human Services is really around the issue of coverage expansion or Medicaid expansion. And as many of you know, in prior legislative sessions, the legislature really left that to the governor to negotiate with Secretary Sebelius, and we know that that meeting is going to be taking place later this week while the governor is in the D.C. area for the National Governors Association. So we are hopeful that some sort of negotiation will continue around use of the Healthy Indiana Plan and additional coverage expansion, and we'll talk more about that. There was a change for the office. We apologize for the acronyms here, but the Office of Medicaid Policy and Planning That bill is continuing to move forward. There's a lot of discussion around opioids or methadone and how those programs can continue. That was actually heard yesterday. A lot of discussion is ongoing around concussions and appropriate training for coaches in high schools around concussion issues. You've seen a lot of that in the media. There's additional work that's going on around the health issue, and probably from a Coalition for Human Services perspective, we know that some of our members, for example, the ARC, has been very interested in the requirements for the birth problems registry that is with the State Department of Health, and there were originally 3 or 4 bills related to the birth problems registry, and a number of those were actually amended together into one. So we know that that's important to many members. There's a lot of attention right now around addictions and mental health issues, especially with the changes coming with the Affordable Care Act. So we know that a lot of our members are interested in those concerns. And then probably most important to the Coalition for Human Services are the questions around welfare issues around SNAP and drug testing for TANF. So we wanted to let all of you know that the SNAP provisions, both in individual bills and in the drug testing bill itself, were amended out. And the drug testing for TANF bill was amended yesterday, actually, to remove the drug testing for everyone except for those who were formerly convicted. And I'm getting some feedback. I don't know if that's coming from Mark, if it's coming from your computer or someone else's, but we might want to put on mute if you're not speaking. So the drug testing bill, 1351, is radically different than what the bill was before. So there's a great attention on helping former offenders get back on their feet, to allow them to have access to programs like SNAP and TANF, and because of the issue of recidivism, encouraging some drug testing with that. But that bill actually was recommitted to appropriations, I believe, so that bill will be ongoing. I don't know, Mark, if you want to talk a little bit about some of the choice program, or if I should.
Go ahead with the choice.
Okay.
You're probably a little closer to it than I.
Okay, so the choice program we know is a very important program for seniors and people with disabilities, and that program passed the House with very strong support. The bill itself passed the House with very strong support. So that, and I apologize, we're getting some feedback again. I think I'm hearing it back through your computer, Mark. If you could mute your computer and listen through the phone.
Then I can't hear you.
Oh, I apologize. Okay, so I apologize for the technical difficulties for folks on the computer. I apologize. So the choice program, what this bill would do is to lower the number of ADLs that would be required, and to change some of the income or asset threshold. And that bill had some strong support through the House and now has met a little bit of resistance in the Senate, so we will see what will happen with that bill moving forward. There were some other bills that you can see here that are very important for people with seniors and people with disabilities, including the nursing home moratorium bill, which we know has unprecedented kind of collaborative support by a number of associations, but also had a little bit of resistance by some folks in the industry. So you see that a number of other bills, like the tax credit for family caregivers, actually have not moved on. So those died in the first half. So where are we as a state with thinking about healthy Hoosiers? Where are we with the Affordable Care Act implementation? Most of the provisions, as you know, went into effect in 2014. And just to give you an update about some of the most recent numbers that are coming out of CMS, it appears that about 47,000 uninsured Hoosiers have now signed up, actually more than that, but through the end of January have signed up through the marketplace, because we participate in the federally facilitated exchange marketplace for those individuals between 100 and 400% of poverty. And as mentioned earlier, Governor Pence is meeting with Director Sebelius, Secretary Sebelius, actually tomorrow, to talk about use of the Healthy Indiana Plan as the expansion vehicle. And the FSSA actually announced that next month there will be a hearing on repealing the wait list for HIP. And there's the LSA number if you'd like to look that up. We'll be sending out more information through the ICHS newsletter about that hearing. We understand that FSSA has already reduced or eliminated that wait list, and the applications are coming in and actually being processed for HIPs as the eligibility had changed at year end. We continue to have a little bit of a coverage gap that includes those uninsured Hoosiers who make too little to qualify for the marketplace but make too much to qualify for Medicaid, and those folks hopefully would be able to get onto HIP. So I apologize that that slide is out of date. It says there's a waiting list. There is no wait list anymore. So Mark, do you, okay,
Yeah,
you want to talk about some of our priorities around working Hoosiers?
Yes. There have been several discussions about unemployment benefits and such in this session of the legislature. The bill that is moving is House Bill 1364, which kind of pushes the burden of proof for unemployment to the employee, and also changes some drug testing provisions with the bill. That has moved through the House. It moved through the Senate committee earlier this week, and will be continued to discuss in the legislature. Anticipate that being a conference committee. The thing about SNAP and TANF benefits has gone by the wayside in terms of providing services to people where their drug convictions have been expunged. There's another one is about transit, Senate Bill 176. That relates to funding for Central Indiana mass transit activities. It's gone through several changes, and you may, if you've been watching this is about the third year that this issue has been debated. The important part for people outside of Marion County is that it sets a precedent for how we might be able to pay for public transportation. That bill is scheduled to be in Ways and Means on Monday. There is also a bill that's alive that indexes for inflation, in essence, tax exemptions for individuals and dependents who are blind and elderly. I believe that's gone through Ways and Means now, and is pending further action in the House.
Right, and that is actually a priority that was announced by the governor in terms of providing additional tax exemption, especially for families, thinking about the child tax exemption, that had not changed in so many years, and this would be a family-friendly tax policy.
Let me point out at this point that they did a revenue update in November about what they anticipated the budget income to come in for the remainder of the state fiscal year. The January report was even under what they had revised it. So there is a growing concern among many legislators about what state funds are going to be available. And there's a lot of caution that has arisen in the last 10 days to 2 weeks on that issue.
Okay, thank you. And as you can see, there were a couple other bills that didn't quite make it to the second half. So I will take the next slide gladly because this is something that we at United Way work on very closely, and that's early care and education. And we are thrilled with the level of attention by legislative leaders and the governor to the importance of early education. So there was a lot of great enthusiasm to create a pre-K program. There was a bill, House Bill 1004, that would have created a 5-county pre-K pilot, but yesterday the Education Committee in the Senate actually amended it to study the issue given some of the concerns that were raised and the fact that the fiscal on it is one of the concerns, because this being a short session doesn't actually deal with the budget implications. That would have to wait for next session. So that House Bill 1004, the pre-K bill, the pre-K pilot bill, was actually amended yesterday to be a study committee. And we anticipate that there will be a good study. They'll have to make a recommendation by November for the next session to be included in the budget. What we are very excited about is the CCDF bill around child care. That's House Bill 1036, that would level some common sense requirements for any child care provider that accepts taxpayer-funded Child Care Development Fund subsidies. So that bill has passed the House 71-24, moved to the Senate, is before the Senate Health Committee, had a hearing, and is expected to be amended and voted on next week in committee, and then we hope for a strong showing in on the Senate floor. There are two other bills that relate to early education. One is property tax exemption for certain level 3 or level 4 early education providers that are for-profits. That's actually before the Ways and Means Committee today. And then a slight provision that was in response to an issue in Columbus, Indiana, where they had a referendum to help support their pre-K program through the schools. And this would allow them to be more specific in that referendum language. In terms of the rest of education, go ahead, Mark.
I'll pick up real quick here. The bill about cursive writing, this is the second year that Senator Lysing has brought this issue up to require schools to teach cursive writing. It passed the Senate fairly handily. Senate Representative Boehning, the chair of the House Education Committee, has indicated he's not going to hear this issue. But as we know, nothing's ever dead until it's dead. There is a big bill that's moving forward about teacher qualifications, House Bill 1388. And this relates to how would they measure the performance of a teacher and relate it back to where they got their degree from. And the bill, House Bill 1388, was heard in Senate Education Committee last night, and they anticipate that it'll get voted out of that committee next week. Most players with this, around this thing, whether it's people that are concerned about either K through 12 education or higher education, are basically now in agreement with the contents of the bill. School bus safety, I've forgotten what school bus safety was. Do you recall?
I do not, actually. I would have to look that up. I know that there's been a number of school bus safety bills that looked at appropriate placards, signing. They've looked at seat belts, but I think this is just it has to do with the test. I can't remember. I hate to say. We will look that up and get that out to folks.
School discipline code is in House Bill 1319 now. There's been a variety of discussions about that bill. It, too, has been heard in Senate Education, but I do not believe that has moved out of committee yet.
I believe it was just amended in there.
Okay.
into a giant Education Matters bill.
Oh, yes, that's correct. Senate Bill 330, Scholarship for Adult Learners, was heard this morning in House Education and was amended slightly. The issue here is, how do we help pay for adult learners that want to go back and actually complete school as opposed to getting a GED thing? And again, the issue comes up as in terms of this bill is, are the funds available to pay for this activity?
And then you can see that there are a number of bills that are sort of grayed out on this sheet. Some of those those ideas, anytime you see an idea that is grayed out, the idea itself might still make it back into an amendment in the next couple weeks, but it is probably unlikely. I know that there was a hope that the in-state tuition for immigrant children who were brought here as children by undocumented parents. I know that there was a great deal of hope that that would be able to move forward, but it's not looking likely at this point. I think there was... Go ahead.
On the school bus bill, it was about providing that the state school bus committee can adopt rules about signage and some physical examination certificates for drivers, and who can certify the physical examination of those drivers.
Okay, thank you. So we're going to move to the child services area for just a quick moment. As many of you know, there's been a great deal of attention on child services over the last several years, and many of those bills passed over the last 2 years, actually, making significant improvements in the Department of Child Services. And now there are a few bills. One is actually one of the governor's priorities, and that's this notion of adoption tax credit. And that bill is moving forward. There are some other bills related to adoption, adding other types of relatives than those that were defined. So it could be someone who's a close family friend, could be determined to be an appropriate placement, for example, rather than just mother, aunt, uncle, grandparent. And then you see some other changes around child labor law that has to do particularly with small businesses who employ their children.
And that has been a rather controversial bill as it moves.
Do you want to give us an update on the Thriving Communities bills?
As you look at this list, you'll see most everything has been grayed out. The bill on land banking, on energy efficiency planning, complete streets, firearm protect regulations have all dropped off to the wayside here. There is a bill about demand side management, and that relates to energy efficiency programs and efforts by the State Utility Regulatory Commission about goals and objectives for businesses and utilities to reduce energy usage, saying, well, that's far cheaper than to build a new power plant. That has become a controversial bill. It has been held today was the third day in a row that it has not been called down on second reading in the House. Anticipate the bill will move forward next week. Exactly what it's going to look like is up in the air. A reminder that things are not dead till they're dead would be the firearm regulation with a gun in locked cars in school parking lots. That had been, the bill had not gotten a hearing, so someone tried to put it in a committee, a large committee, and then for another bill it was put in the committee. The speaker found it out later that day and assigned the bill to another committee to remove the provision. So it gets crazy.
Okay. And there were a number of redistricting or good government bills, and those are still alive, but a couple of them are awaiting hearings. So that as Mark said, nothing's dead until it's really dead, but there is the clock is ticking on getting bills through the second chamber. We did want to give you an important update about what's happening with tax credits and some of the interim study committees, because there are two fairly significant policy changes that are moving through. One is in Senate Bill 80 that would consolidate a number of study committees, and essentially it places a number of those individualized committees into a single Human Services Committee. So for example, those of you who are concerned about or who may know that there's a commission on autism or a committee on child care or the Commission on Mental Health and Addictions, a number of those committees are being consolidated into a single committee. And this was driven, as I understand, from a concern about costs and about the number of committees that the Legislative Services Agency is required to keep up with over the summer. Drafting bills, doing research, providing fiscal analysis on all these different types of ideas for all of these committees, because the LSA, the Legislative Services Agency, has to staff those. One positive sign is that the Child Services Commission, that we know many folks on this webinar were involved in helping create, was actually folded into the Commission on the Status of Improving Children. So there will continue to be a great deal of attention on children through that multi-agency commission that exists. Do you have any other comments on Senate Bill 80 or that consolidation,
No,
Mark?
I'll jump into the tax credit one here.
Okay.
As several of you may be familiar, in 2012 and 2013, the State Tax and Financing Commission on State Tax and Financing Policy reviewed 29 different credits and gave reports back on those things. What is being contemplated now in House Bill 1020, and it may end up somewhere else too, is to create a more formalized process for evaluation of these various credits, and would create a plan for over a 5-year time frame to evaluate all these things. The concept is to do it on a regular basis. We're reviewing the list of tax credits that are in the list. We don't believe it's as comprehensive as the list as it perhaps should be, and trying to make sure that it's a fair evaluation process, and that if we're going to look at tax credits, we look at them all. But among those that are in this package of stuff are the Earned Income Tax Credit, the College Savings Credit, the Neighborhood Assistance Program, various economic development incentives. It is not designed just to suddenly get rid of them like past times, but it's intended to say we need to look at this overall, which is not necessarily a bad policy. We just want to make sure that it's a fair process and that it includes all of those various income tax credits.
And following along those lines, one of the recommendations that we from United Way have made in the past is that as those tax credits are studied, that they be grouped in about similar types of intent. So if a tax credit, for example, is designed for the purpose of an economic development incentive to create jobs or to improve training of employees, and that it should be measured against similarly designed tax credit programs. So you see the way that we've grouped them here. EITC and Unified Tax Credit for the Elderly are specifically designed to help low-income or working Hoosiers or low-income seniors. The 529 Savings Plan and the IDA programs are both to encourage savings programs, and NAP, School Scholarship, and College Contribution Credit, for example, are 3 types of charitable giving incentives. And we as Mark mentioned, we're interested in seeing what happens with these bills as they move forward. Some of the language is moving among different bills. As long as all of the tax credits are reviewed equally and are provided the same type of review, it makes sense to have that kind of review and to actually calculate the impact on the budget from a policy perspective. So before we move on, I'll just mention that if you have a question about any bill that we have mentioned, now is the time to ask that in the chat box or in the question box. We did receive one question, and that was with regard to the SNAP and TANF eligibility for those who had drug convictions expunged. The question was, is it an idea or is it a done deal? And it was an idea that was proposed, and there was another bill. I'll just talk about sort of the attention to ex-offenders in general. There was another bill that actually expanded the use of NAP credits to include programs that would help ex-felons with jobs after they are released. To the question about the expungement and benefits, I believe that that bill actually did not go, it's not still alive. Is that correct, Mark?
That's my understanding.
Okay. But we know what's positive about that is that there is greater attention to the concept that people, after they're released, you know, they've sort of paid their dues and they need to have opportunities to stay on the right track. And there's a greater attention in the legislature to that. We want to mention one of our resources, and that is the Guide to Safety Net Programs. We have these available online at ichsonline.org. We also take them to different meetings, or if you would like to have a copy of it, you can certainly call or email us. We ask you to consider joining ICHS, but one of the new features of the guide this year is that we include a poverty chart that just helps explain to maybe your board members, your staff, what exactly is the 100% of poverty or 133 or 150% of poverty, and the various programs that align with that. So this safety net guide provides you examples of SNAP, TANF, unemployment, LIHEAP, all of the basic kind of safety net programs that Hoosiers rely on. So in this last section, I'm not seeing any additional questions yet. In this last section, we want to simply remind you that nonprofits may advocate, and we certainly encourage you as nonprofit human service providers or partners, whether you're a board member or a staff member, we encourage you to tell your stories. Why are you involved in the work that you do in terms of helping people, and what kind of impact that makes on your community? If you have a specific issue that we've mentioned as an active bill, you need to act fast if you want to have an impact on this 2014 session, because as Mark mentioned, there are only 3 weeks left. We provide you a lot of tips here about how to get started. We've covered these in prior, so you're welcome to revisit our previously recorded webinars about how to get in touch. The legislators do continue to have third house sessions or meet your legislator sessions on the weekends. Most of the legislators are in Indianapolis between Monday and Thursday, and then they often have these meet your legislator sessions either on Friday, Saturday, or Monday morning, and we encourage you to attend those, ask questions, advocate your position. Also have your board members and your volunteers do that, because it's so important that lawmakers really hear from local folks about these issues. And all of you have connections. We talk about sort of mapping your relationships with the 6 degrees of separation with Kevin Bacon. All of you are connected to your lawmakers in some way. It might be a couple sort of clicks away. And then we ask you to invite them to your facilities if you have an organization where you can show what you do. We like to work with you. That's why this is a joint webinar with 3 different organizations. We all try to educate and provide information to you through our newsletters and our updates that we send out. We both have bill lists through ICHS and IUW, and then many organizations offer a day at the State House where you're welcome to come to the State House and meet your legislators, and any of us associated with ICHS would be happy to help help your first time visit if this is the first time you're visiting the State House. We've provided a number of websites that you are welcome to take a view. The in.gov/legislative website is where you find the information about the General Assembly. It is a newly revised website this year, so it did have a little bit of hiccups as it first was launched, but it is now working very well. So you can actually sit from the comfort of your computer, maybe even in your jammies in South Bend or Evansville or Crown Point, and watch a legislative hearing, watch what's happening, and then contact your legislator either via phone or email. You see some of our partners, the Children's Coalition, the ICHS, and the Cover Indiana websites as well. We've provided a number of additional websites for you that are available to you. And then lastly, we will thank you all for being such great human service partners around the state. It's so important that we all work together and we hear from you what are the needs in your communities and what how these different policies would impact your clients and your communities. So I will make one last call for questions. If you have a question, put that in the question box or in the chat box, and I'll offer, Mark, do you have any closing comments?
Glad for everybody to pay attention, and feel free to contact either Lucinda or I if you have other questions that arise in the future.
Great. Well, thank you. I'm not seeing any additional questions, so we will wrap this up. Thank you so much for joining this second of our series of 3 webinars. This was our mid-session update, and we will have another session or another legislative update at the conclusion of the session in late March. So again, thank you for joining us, and keep up the great work around the state of Indiana. Thank you.
Thank you.